a liver-friendly diet,
Liver.
low fat, low calorie, low sugar, high fiber.
Okay. What's something important with their diet regarding warfarin?
Oh, you need to avoid foods that contain vitamin K.
That's exactly right. Very good. Okay. Group 5, do you have any more teaching or plan of care for this client?
We said that as far as the Tylenol goes, it did say that it is liver toxic, and I know you discussed earlier that you can still give it. I would probably, because what we discussed prior to this, we would say that we would see how often they take it and how much they take to kind of further assess how that would affect them. And then just give more teaching on like the DVT and the liver disease as a whole, just to like better their health. And because sometimes they may not have a full picture of what they need to do. So kind of just further educate on that stuff as well.
Okay, very good. What about activity level? What would you think, group 5? What would you think about that?
You would keep them bed bound, because you don't want them getting up and around, because you don't want their like to break off and cause further damage.
Yeah. What are they gonna wear anything on their legs, maybe?
The compression stockings.
Yeah, that's right. So as far as activity level with DVTs, normally in a hospital setting, you're correct. They are on bed rest. Often, however, that patient may be discharged from the hospital without having the clot fully dissolved, at which point you would need to encourage them to just stick with what their doctor has told them about when they can resume activity. Because the thing with blood clots, you need activity to prevent them, but then once you have it, you don't want it to move. So it's very important to stay with the doctor's recommendations regarding activity. Otherwise, and if you leave that out of your education, your patient may end up really in a bad place once you discharge them home if they're not adhering to those exercises. All right. Now I have associated risk, but I'm kind of thinking like nursing diagnoses for this patient. When you think about them, what kind of risk is this patient at risk for? Group 1, bring you in again.
We said hepatic encephalopathy. I can't think of the name, just because of the level is so high that they can get their mental status changed. Okay. And then as well, you can have your edema, increased bleeding, the fluid retention with it.
Very good. Did anybody else come up with any other increased risk for this patient?
If they're bed bound because they're DVT.
Mm-hmm.
And then also dehydration because of the lactulose and all that goes along with that.
And the aldactone on that one.
And then also we came up with hyperkalemia because of the because of his situation with the aldactone and everything like that.
Okay, very good. Very good. Maybe risk for malnutrition. When you think liver, you think about ascites. And ascites, is being, they can't process the protein. And so when you think about the starving children that are on these commercials that make you cry and they have the bloated belly, it's the same thing, that malnourishment in a liver patient. That's what that is. Dr. Craven, do you have anything to add on these?
I think they've done a good job of pulling all of that together.
Yeah.
Really good. Did that help? Did anybody find that those discussions really kind of opened our eyes about things that we need to pull together for questions?
Yes.
I hope.
Yeah.
Very helpful.
Good. Well,
Good.
And part of the reason too that we wanted you to come up with some questions to ask yourself, it helps you get in that mind frame of how to make the case study relevant to NCLEX, because I mean, they really do correlate, that your mind has to come up with the way of, okay, how does this actually relate to NCLEX questions? And if time allows at the end, we'll go over your questions you came up with. I'm hoping we get to that, but We'll go ahead and move on to the pre-quiz review.
Okay. Hold on. Let me get there.
Okay. Me too.
Hold tight, guys. Let me get to it real quick.
I will say, in reviewing your pre-quiz scores, the average score for the class was a 4. So I just say that to say, guys, again, Dr. Craven and I are here to help you with some test taking strategies. So I'm thinking as a whole, again, my goal is that at the end of this, some of this will make sense, to where you can go do this with confidence. Okay.
All right. So do we want to go with just from the top down, or do we want to start with question 1? Ms. Wilson, whatever works for you.
I was thinking we just go question 1 on the
Okay.
PowerPoint.
Sounds good.
Got it. Okay.
Okay. So 4 of you responded to A. Bathe and shampoo hair for a client. And this was, a nurse is planning care for 4 clients. Which of the following tasks should the nurse instruct the AP to perform? So 4 of you bathe and shampoo hair for a client recently admitted for the ER. No one selected B, and no one selected C. And 11 selected provide hygiene care to a patient 2 days post CVA. So that's how they responded. Is that good, Ms. Wilson?
That's good. That's good.
Okay. Guys, does anybody want to discuss that question?
Yeah, can we pull up the, Dr. Craven, pull up the slide number 14?
Would
Sure.
you not consider them unstable, or is it going to specify if they're unstable? Because
Okay.
do you want an AP bathing a client with a CVA if they're still unstable?
So here, this will help you on NCLEX. It is always going to be assumed the RN has unstable clients. The AP and the LPN, they have to have stable clients unless specified otherwise. That will
So
always.
if it had said unstable, then that would have been a no. 2 days post CVA, still unstable, then no.
Correct.
But it didn't say, we would assume that they were stable.
Correct.
I think number 1 was wrong because it said recently, right? Because it said recently admitted from the ER.
Yeah,
Or that was the word that made it, because it was like,
because I almost went with that one at first, but I didn't because of the recently word.
yeah.
I'm on the right.
Yeah. I'm sorry, guys. Hey, let's pull that slide. Let's wait till we can get that slide up. I'm sorry.
Hold on.
Okay.
I apologize.
So generally speaking, when it's like a heart attack patient or stroke patient, it's like 2 to 3 days post event, we're going to consider them stable unless it specifies otherwise.
Correct. Because think about a stroke. A stroke is an accident that happens. Now, in that first 24 hours, you're having to evaluate, can they swallow? You're having to evaluate, can they walk? You're having to evaluate mental status, all those things. But once that initial first day of evaluation is over, they're pretty much stabilized by that point. So, okay, well, let's see. We get it.
You want me to move on?
Well, I'm trying to get that. Can you get the slide up for this question?
I apologize, guys.
It's okay.
Hold on.
Because I want us to actually.
There we go. Nope.
Okay,
Sorry.
go back. There we go. Okay. All right, so you guys can all see this. So for those of you who picked A, the client requesting assistance to the bathroom 1 day post hysterectomy, or those of you who did not pick that, why didn't you pick that one? Somebody be brave.
This is a different question than the one we just talked about.
Yeah, this is where we were supposed
I
to.
picked it because they were so close to having surgery.
Okay.
Like 1 day post-op hysterectomy. Do I really want an assisted personnel assisting them in the bathroom with, abdominal surgery?
Okay. Well, so here's the thing with that. A hysterectomy is a same day surgery. If you've ever been, I can just say, just being a nurse, we're practically getting them out of recovery, walking them to their room for this surgery. For a hysterectomy, gallbladders, it's the same day. It is we want them up, moving, up, walking. And so, yes, that is appropriate for an assisted personnel. They're stable. We're not saying the hysterectomy went bad. It's just a hysterectomy. So they are allowed to get up and walk, because that is considered a stable patient. Now, as far as B, a client who needs hygiene care that was newly admitted with MVA. Who picked that one and why? Anybody be brave? Did anybody pick that one?
Yeah, we had 6 that selected that one.
So come on, somebody be brave. Why'd you pick it?
I picked it. It doesn't say that it was serious. It could have just been a fender bender, I guess, and they're just getting checked out.
Well, they're newly admitted. We wouldn't admit them if it was a fender bender. They may come to the ER, and then we will screen them out. But if they've been admitted with an MVA, you can assume there is a reason.
I picked it because it was just hygiene care, and that's a simple task. So I thought, okay, you're just going in to wash them up and clean them up. Okay, should be simple for an NAP to do.
Okay. And that's valid. That's
So looking at the word needs, it didn't say a client is requesting, it said a client who needs hygiene care. So I kind of looked into that. Maybe I read too much into it.
yeah.
So was it right or was it wrong?
So that one was wrong. The correct answers on these are A, C, and D on this one. Okay. So with the motor vehicle accident, they're newly admitted. At that point, like if we're admitting someone because of a motor vehicle accident, there is something wrong. There is a spine injury, there is a femur fracture, and if they're brand newly admitted, we're going to assume that hygiene care is not on the priority list at this point. It's not quite there yet. They're newly admitted. We're worried about spine injuries. We're worried about controlling their pain. So pretty much that's going to be an unstable client at this point. They're still considered unstable. So if you can kind of correlate that.
My thought for not picking that one too was, like say they need hygiene care. If I'm gonna do that, I want to see their skin. Like I want to see a complete skin assessment, and do they possibly have like intracranial pressure increasing? Like I'm not gonna want to mess around with their mouth if that's the case.
That's good. I'm going to do that. I'm their nurse. I want to take care of them head to toe. That's not going to be something I'm going to delegate to somebody else. You're right. That's very good. Okay. So as far as a client who is requesting ice chips and Jell-O, is that within an AP scope of practice?
Yes.
Yes. That is within their scope of practice. So the next one, a client who is 1 day post cholecystectomy requesting to walk.
Yes.
Everybody good on that? Is that within their scope of practice? It's kind of the same as the hysterectomy. 1 day post-op, they can get up and walk.
I have a question regarding these.
Okay.
So as long as when you're delegating to like a UAP or something, as long as it doesn't say first ambulation, like without the nurse, then they can do it, correct? Okay.
Correct. Okay, so option E was a client just received from the PACU needing PO medication.
No.
Anybody think yes?
No.
No, a UAP cannot give medication. So that's correct. And they're just receiving PACU so they're not stable. So again, the correct answers were A, C, and D. Everybody okay with that? Does that make sense? I can't help you if you don't say something. Come on.
Yes, it made sense.
Okay, cool. Dr. Craven, anything to add to this?
No,
Okay.
good.
Just again, for UAP, for delegation questions, think the nurse gets unstable. Everybody else can help with the stable ones. All right, so let's move on to the next question. Number 2. A nurse is planning care for 4 clients. Which of the following tasks should the nurse instruct the AP to perform? Now, the correct answer was D. So let's see. Let me look, see how we got D.
11.
Okay. All right, so let's start with A.
Pick that one again because the CVA.
Okay. Okay. All right, well, let's start with A. So again, if we're gonna bathe and shampoo hair for a client recently admitted from the ER, are they stable yet?
No.
They're just from the ER. They are not stable yet. Good job. So B, aid a client who is requesting a bedpan post lumbar puncture. Anybody pick that one?
No.
Why wouldn't you do that?
Because they gotta lay flat and still.
That is correct. Yeah, if somebody's trying to put my post lumbar puncture patient on a bedpan, I'm running in there saying, no, don't move them. Big no. Okay. So C, change the linen of a bed-bound patient received from PACU.
They're unstable. They just came from PACU.
That's right. They're not stable yet. Good job. Okay, so D, provide hygiene care to a patient 2 days post CVA. So by this point, yes, we are assuming them stable. 2 days is fine. We're just giving a bath. It's not like we're feeding a stroke patient. We are providing some hygiene care. So yes. Okay, everybody good on that one? Any questions? No? Okay. All right, let's go to the next one. So number 3, an LPN reports the following data to the RN regarding a client with congestive heart failure. Pulse oximetry 85, respirations 26 per minute, coarse lung sounds. What is the priority action at this time? Okay. So somebody that chose A, tell me why you chose A.
I always narrow it down to 2, and I always pick the wrong one, and I chose A. But I was thinking, you got to get the fluid off so that they can get better. That's what I was thinking.
And that's a good thought. But scope of practice, can an LPN push IV furosemide?
Yeah, that's what I was thinking. That's why I said always pick 2 and pick the wrong one.
So there you go. Scope of practice, an LPN cannot push anything. And furosemide is a med that you would push. Okay. All right, so B, the LPN will notify the respiratory therapist. Somebody who picked this one, tell me why you picked it.
We were 0 on that one.
Oh, there were 0. Good job. Why would you not pick that one? Somebody give me the rationale of why you rolled that one out. Why would you not pick it?
It would mean
Yeah, don't pass the buck.
That's very good. Plus, if you're thinking,
it was a changing patient, so LPN shouldn't be dealing with it anyway.
okay, and that's exactly right. But another thing too, so what does this patient need? They have CHF, they can't breathe because why? Why can't they breathe?
A heart problem, not necessarily a respiratory problem.
Okay.
Having respiratory difficulty, but they need the fluid removed.
That's exactly right. Respiratory pushing oxygen on wet lungs is not going to help anything. Lasix is what is needed. If the LPN can't give Lasix, the LPN needs to D, turn the care over to the RN so the RN can give some Lasix. Any questions on that? You good? All right, number 4. Which of the following medications would you give first? Now, not one of you got this correct. So let's talk about it. Okay, so who chose A? Warfarin to a client 2 days post DVT. And tell me why. Tell me why you chose it. Anybody?
Okay. We had one select that, so.
Okay, well then I won't call you out. Okay.
I mean, it was me, but now that I'm reading it, like I don't really have a reason to give you. So
okay. Okay. Well, here's the thing with this client. If they're 2 days post TVT, they should already be on a blood thinner and have it in their system. That being said, warfarin's not like a priority. We got to give it now. Okay. So on these prioritization questions, these what should you do first? You have to kind of look at which situation is the most dangerous if I don't do it. So warfarin, they should already have some blood thinner in their system, so we can get to them.
That's what I was thinking of. I wasn't thinking like, okay, they already have it in their system. They don't like need it right now. I felt like in my head was like, okay, well they need this, but it's not necessarily the first. They need it, but it's not the first.
And you're very true. They probably do. And we're going to get to these patients. Like just because you prioritize one doesn't mean the others aren't important. We're going to get to them. It's just which one needs it first. But good thinking though, because they do need it. So option B, O2 at 2 liters for left-sided CHF client. How many picks that one, Dr. Craig?
9.
Let's see. 9. Okay, so somebody talk to me here. Tell me why you picked that one.
I was thinking like ABCs, like airway, like maybe they needed the oxygen. That was just the first thing why I chose it.
Okay.
I agree.
Okay.
But that,
And
but
oxygen to left-sided, because left-sided
is your lungs and it doesn't need oxygen.
is
It's got
receiving
fluid.
your oxygenated blood. So that was my thinking.
Okay. This kind of goes back to the last guy we talked about in the last question. We're talking CHF. We need Lasix because throwing oxygen on wet lungs, it's not going to really help. But if we can get the fluid off, so I see what you're saying. You're always thinking breathing. And I quote somebody in one of your breakout groups. I heard the phrase, oxygen is a gimme answer. And it is. But in this case, it's the wrong gimme answer. Because what we need to do is remove the fluid for CHF. So, going back to test taking strategies, I mentioned, even if you have a great answer, you have to go back and look, but does it actually answer? Does it fit? Does it fit the scenario I'm asking for? Okay, so that one's not a priority for the CHF patient. So let's go to C. Stool softeners to a client with portal hypertension. Why did you guys not pick that one? Somebody tell me why. What was your rationale?
So I go back to what Anna said, and I look at, the airway, breathing, circulation. That's got me a lot in the past. So I've literally had to beat it in my head that airway is a problem, which that may have been a problem, but I just seen shortness of breath and O2. So I fought between the two, the B and the D, and totally overlooked the C.
Okay.
Know very much about portal hypertension, and so I saw that and I thought, well, maybe there's a correlation, but I don't know, and so I don't like to guess if it's something I don't know.
Okay.
Yes, I definitely need to go back and look at portal hypertension again.
Okay.
I'm guessing the reason, I just saw stool softeners and just completely eliminated it. But now that we're discussing it, I'm thinking if somebody's constipated and they're bearing down all the time, then they're liable to vagal out or have maybe, I don't know.
So let's go back to our case study, guys. That is our portal hypertension patient. We've got a liver that is hard as a rock. that patient is on lactulose to help them poop. Because if that patient with portal hypertension bears down, then we're worried about the esophageal varices that EGD showed bursting, and they're gonna bleed out on your table, in your hospital room. We've got to keep their poop soft. So that is portal hypertension, which was totally our case study, okay? So we'll come back to that. Let's talk about D, Lasix to a COPD client with shortness of breath. For those of you who did pick Lasix for the COPD client, why did you pick it?
Because there was CHF.
I definitely read it as Lasix to a CHF client with shortness of breath.
Yes.
So B and D were really good distractors, and NCLEX will do that. See, B and D, if those diagnoses would have been switched and it would have been oxygen to the COPD or Lasix to the CHF, then we would have something to talk about. But because they were backwards, they just distracted you guys. You're thinking airway breathing. But really, I mean, C is the correct answer in this case, because if we've got a patient in the hospital with portal hypertension, we do not want them bearing down because it can be a quick emergency. I've been in situations like that with these liver patients, and if they have varices, they can go from stable to unstable literally in a minute, and it is a huge emergency. So does that make sense? Any questions? Dr. Craven, do you have anything to add?
Nope.
Okay.
Again, I think, I think Autumn and Joey both said, I read it this way. And so it's hard for us to make sure that we're reading it the way it's written. It's just hard. We automatically, we assume. And so sometimes just really reading that question, and it's hard to train your mind. And that's what I talk about a lot is read that response. Is that what it's saying? Read it a couple of times. Cover everything up. Put your finger under the words. CHF, COPD. Just trying to make sure that we are not let our brain read what we want it to read. Really reading those responses. And guys, I tell you that because that is a very dear lesson that I struggle with. And so I very much have to use those tactics of putting my finger under words, slowing down, reading those responses, because I struggle just like you. My brain reads it one way and it'll be totally different than what it says. I want it to say CHF. So I get that. So
and those questions that say effective or ineffective, I was the worst at that. I would read ineffective when it said effective. So you have to slow yourself down, make sure you understand what the questions are asking and the answers are saying. All right, let's go on to this next one. So what would be included in teaching a client who is newly diagnosed with CHF? And that's one of those dreaded select all that apply. Okay, so 14 of you picked A, which was make sure to take several rest breaks throughout the day. Why did you choose it? Anybody, rationale?
Overexertion exertion with heart failure can lead to like an exacerbation. Like that's just what I thought instantly.
Okay.
Because they get out of breath easy. They have that extra fluid.
Okay. Well, A is correct. Did anybody not pick A and want to defend why you didn't? Because yes, that is included in teaching with CHF. Absolutely. Got to take several rest periods throughout the day, especially as it progresses. Those rest periods become more and more frequent. Okay. So 5 of you chose B, need to weigh at least once weekly. Anybody want to tell me why you picked that?
Because that weekly word said daily when I read it the first time.
Aha.
Me too.
So yes, so that is an incorrect answer because it should say daily. Okay, so C was follow up with the physician regarding any changes. Most of you picked that one. So I think that's pretty self-explanatory. CHF is one of those diagnoses that they're high risk for jumping in and out of the hospital. Unfortunately, in the hospital setting, there will be nurses who use the disrespecting term of frequent flyers in the hospital. But the thing is, that is these patients, because they can change so quickly. With CHF, it can be overnight. So that is why weighing every day to check those changes and then follow up with that physician with any changes. Okay, so D, 5 of you picked D. If cramping in lower extremities occur, stop and dangle legs. Somebody tell me why you did pick that one.
I chose it because when my legs cramp, I dangle them. I'm going to be totally honest. I stand up and I stand on them and it helps the cramp. But no, I just thought about, blood getting, oxygen getting to your extremities. You're going to want it to go, your legs are cramping because it doesn't have that. So thinking of the blood flow getting down there, you want it to go down. So you stand or dangle. That was my train of thought.
Okay. But is that going to be included in teaching to a CHF patient? CHF specific teaching?
That'd be
Does
like
that have anything to
PVD.
do with CHF?
Nope. I just thought I'm going to dangle my leg on that cramp.
Yeah, I did that one too, but it should have been like for PVDs and stuff like that.
Right. Or what's that other diagnosis where they have
PAD.
PAD and
PAD,
intermittent claudication, that sort of thing. Yeah. So this wouldn't be included in CHF teaching. Okay. And E, 12 of you picked E. Maintain a diet low in sodium and restrict fluids.
Oh, well, you don't restrict fluids. That's why I didn't do it. But because I did learn that in remediation, you can't totally restrict stuff.
You restrict it to a certain amount.
Yeah.
Limit. So for NCLEX, I know we mentioned earlier, it's all about verbiage. The word restrict, here's the way I want you to imagine it, okay? If you're driving down the road and you see a fence with a big creepy sign on it that says restricted property, if you step 2 feet inside that property line, what's going to happen?
Rest.
You're probably going to get shot. It is restricted. Stay off the property. Okay, so for NCLEX, the word restrict means absolutely no admittance, none, not at all. Okay, so that was a tricky one there, but those are words NCLEX is going to use. Had that said, maintain a diet low in sodium and limit fluids, then we'd have more of a conversation. But even that, if they're a newly diagnosed CHF patient, you may not necessarily need to restrict fluids. That's going to be up to the doctor and based on the progression of disease. So CHF doesn't automatically restrict fluids. Does that make sense to everybody? Anybody it doesn't make sense to? Okay. Dr. Craven, anything to add?
I'm good.
All right, moving right along.
Well, I'm trying.
And I'm pulling it up too. Okay, the nurse has 4 requests from patients all at the same time. Who should the nurse see first? 9 of you got this correct. Let's see. So we'll come back to A and we'll skip B. Nobody picked B. Why did you not pick B? A woman who is returning from PACU seeing bugs. Why did nobody pick B?
That's because she's on propofol or something.
Right. Yeah, that's an expected side effect coming back from PACU. That is an expected thing. That's not an emergent situation. It's unfortunate side effect, but you're right. Okay. So 5 of you picked C, the man with a chest tube complaining of pain at the insertion site. 1 of you picked the man with the fractured tibia complaining of pain of an 8 out of 10. So somebody who picked one of the pain ones, why did you pick this one?
I chose the fractured one. I know that pain is subjective and all of that, and I know that you shouldn't run to those first. However, when I was taking practice questions on Kaplan, and I took notes that whenever there's a fracture,
Mhm.
especially in the elderly, which I know it doesn't say elder here, but whenever there's a fracture, you should really pay attention to those because it can cause mental status changes, and stuff can go wrong very quickly.
Okay.
But, yeah.
And that is very true, but Dane, be careful because you're adding to this. This is saying he has a fractured tibia complaining of pain, not a fractured tibia complaining of mental status change. So when you look at the questions, you have to take, and this is for everybody, you have to take each question as a new question. Try not to refer to things you saw in clinical, things you've discussed with your friends or happened to your mom. Try to just look at what's there. Okay, so most of you got this correct. The woman who is on IV fluids, who is anxious and restless. Somebody give me your rationale why you chose this one.
So I
Fluid
didn't
overload.
choose C or D because I feel like they're kind of the same. So I chose A because anxious and restless, I was thinking they may be drowning, their oxygen may be low,
Yes.
it may be up too high, too many fluids.
Yeah, that's exactly right. So if we're getting IV fluids and all of a sudden we're getting anxious and restless, yeah, we're probably drowning. I mean, think about you. If somebody was always just pouring water down your throat or threw you off a boat into the middle of an ocean, what are you going to feel? Anxiety, that restlessness, that fullness, so yes, that is why A is the fluid overload patient. Everybody good? Does that make sense to everybody? Okay.
Good.
All right. Well, then let's move along.
Whoop. Sorry.
All right. The nurse is performing triage on a group of clients in the ED. Which clients should be seen first?
D.
Okay. The correct answer was D. Why, somebody?
MI.
Yeah, it could be symptoms of a heart attack, subtle symptoms.
Mhm. Oh, it could be more than subtle. Look at the wording. The patient is complaining of indigestion. When you're thinking about a SOAP note, you're thinking about subjective information. That patient says, I've had indigestion for 2 days. They think it's indigestion, but that is their complaint. We as the nurse have to use the critical thinking of, you may be complaining of indigestion, but I know better. Another thing too is the 2 days. If they're complaining of indigestion just overnight or just after they ate a pizza, that's a little different. But when you've had unrelieved indigestion for over a day, the nurse needs to immediately think cardiac. All the other patients, we complain of pain, that's expected. B. So let's talk about B for a second. So we've got a 10-year-old with a temperature of 100.1, a cough, and a sore throat. So what would be our action for that patient? What could we maybe delegate to somebody? Because 100.1, I mean, that's a fever. But are we not worried about it to do anything about right now?
No.
So probably the appropriate action would say, call your UAP and say, hey, would you mind rechecking this fever in 30 minutes, making sure it doesn't spike any higher? Thanks. So that's a kind of continue to monitor, and we're going to recheck that fever. Now, I'm surprised that more of you did not jump on the lacerated finger. But so if we've got a 45-year-old with bloody gauze and a lacerated finger, the bloody gauze shouldn't worry us. If we have a lacerated finger, there is going to be blood. But guys, you could cut your finger off and go to the ER and you are not going to bleed out. So the lacerated finger, I mean, the word lacerated sounds a little gross, but it's really not a huge deal. Now, what will probably happen if this was a real scenario, if we take the lady with indigestion and we go do an EKG and the EKG is normal, we'll say, okay, sweetie, we're gonna let you sit right over here and we're gonna go sew up this guy's finger. But we got to rule out cardiac first, because that is the thing of these patients that could go bad the quickest.
Yeah, I said C because of the bleeding. Now, if D would have said a female, I would have chose D because I know females have the atypical symptoms, so I didn't choose it.
Men do too. Honestly, working in the ER, yeah,
okay.
You're right, females do, but men too. You got to jump on it with them too, especially if they don't have a cardiac history that they know of. They may describe that feeling of feels like I got heartburn, but it's because it's new to them, and so they don't know what else to call it. So a lot of times their complaint will be, feel like I got indigestion.
I think if C had said like uncontrolled bleeding or amputated finger, I still think D was more important, but it would definitely have been a bigger distractor if it had said uncontrolled bleeding.
Sure. Yeah. Well, and that's one thing too. NCLEX, while sometimes the wording can be a little misleading, they're not going to, like in this kind of a priority situation, NCLEX is not going to give you an acute heart attack and a hemorrhaging leg. Like they're not going to give you two emergencies and make you pick. There is pretty much on Dr. Craven. Do you agree? I mean, there's going to be one that is an obvious, like this is the one that could go bad. They won't give you two emergencies that you have to decide which, that's ethically wrong. So now in real life, all day long, you're going to have to prioritize and delegate the best you can, but not on NCLEX.
That may give you something similar, but there's going to be a definite right. There's something about it that's going to be right.
Yeah.
More so than the other.
Mm-hmm. Okay. Everybody good? All right. Two more. Bear with me. Two more. All right. Number 8. Which of the following tasks could a nurse assign to the assistive personnel? Select all that apply. Y'all were kind of all over the place with this one. All right. So A, calculate the client's intake and output. 10 of you picked that one. Tell me why.
Because that's what PCTs do.
But I don't think they calculate it. They'll get it and they give it to you, but then you calculate it as the RN.
Oh,
They
I totally missed
it.
wording on that. I saw it as record.
Okay. And that's the difference. It's the word calculate.
I picked it because in real life you do it. You go document it as a PCT. Mm-hmm. Even though probably it's not really what you're supposed to do, but that's what they tell you to do, all day, every day. And that's what I went back and forth with it. And I thought it was a trick and I went ahead and went with it.
Yeah. It's the word calculate. This is a verbiage thing again. If it would have said, collect the little sheets off the door, you'd be good. But the calculating, and because as RNs, we're going to have things like a patient status post TERP where we've got glycine and we're doing all these flush, and you've actually got to calculate. It can get a little tricky, a little fuzzy there sometimes. That's not assistive personnel. That's us. And it's the word calculate. Okay.
They can document it though, right? Like they can document it. They just can't calculate it. So Joey, you're right. They can document it. But as far as the calculation at the bottom, I think that's where like the nurse.
Well, and I didn't think about medicines because as a PCT, you're just doing drinks and food and pooping and peeing.
Exactly. But the RN has to put in IV fluids and there's a lot more. So the end calculation is totally on the RN. Okay. So we cleared that one up. All right. So it's not A. So let's look at B. Assisting a client with CHF, choose low sodium snacks. Only 4 of you picked this one. So somebody tell me why you did not pick this. Why was this one wrong to you?
I didn't pick it because it said assisting a client choose, which I thought was like teaching kind of.
That's
Yeah.
exactly right. Yep, that is exactly right. Because what's going to happen if, if your AP goes down there, even if they were just delivering something to that client's going to say, but why can't I have the crackers? And they can't teach them why they can't have the crackers. It's going to be us. So yes, that is never right. Okay. So C, feeding a client who was 1 day post CVA. All right. So 10 of you chose this one. Somebody tell me why you chose it.
I chose it because it's just feeding somebody in the bed. But maybe I was wrong from the look on your face. Because
look at my face.
Because it was a CVA. It's too soon. Maybe they could aspirate it or something like that.
Okay. Anybody else got input?
I think I chose that one, but now that I'm thinking about it, in this situation, being that they are 1 day, like that, I mean, I guess that's reading too much into it. That's not to say that speech has evaluated them yet. That's not to say that they can swallow or if they've had a modified or anything like that. So I don't know if it is right or wrong, but I did choose the one, and now I'm questioning it because it is only 1 day.
Okay, so it is incorrect because it is only 1 day. And if they have just had a stroke, usually, I mean, they are going to get to a swallow study. They're going to do that. But 1 day, we're barely getting that patient stable yet. So to put them through a swallow study, that's kind of a few days later. So now, are they not going to eat? Well, of course they're going to eat, but we don't want an unlicensed assistive personnel doing that. So that one, we're not going to choose that one.
Now, what if it said like 3 days?
If it would have said 3 days, we'd have a different conversation. So 3 days, again, we can assume them stable, kind of like we discussed earlier with that other question. Yeah, 3 days, I mean, that would be appropriate because that's not going to be their first meal after their stroke. 1 day might be their first meal, but 3 days is definitely valid. Everybody good with that one? All right, so D, bathing. So D, bathing a client who is 2 days post CVA. Can we give them a bath?
That would be it.
Yeah, they're in the bed. It's a stroke. So moving them, we're not worried about we're gonna hurt something with it with a stroke. So yeah, we can bathe them safely. That's just providing hygiene care. And it's 2 days. So by then we're thinking they're stabilized. All right, so E, ambulating a client who is 1 day post cholecystectomy. We've already discussed this, so is this a yes?
Yes.
Yeah, chole's pretty easy. Okay, so A, just review the correct answers were D and E. Everybody good with that? Does that make sense? Okay. All right, well, let's move on to the last question here. All right, the client is returning from surgery. So which of the following is not appropriate to delegate to the LPN? So there's that word not. Pay attention to not appropriate.
This one was tricky.
Yeah.
D, because I was thinking that D would be more of a teaching kind of thing, maybe.
Because my thought was they're returning from surgery. The RN is going to be the one watching their vital signs like every 15 minutes. Mm-hmm. And so I'm not going to leave the LPN to watch their vital signs and come tell me. I'm going to be watching them.
Okay.
That was my thoughts on that one too.
Is like PACU, like they're recovering from surgery. An LPN isn't going to be in charge of a client who's just coming out of surgery.
I think a couple of these did look good, but the thing that got me that made A, the reason why I chose A, was informing the family. Like, I feel like that should be the RN talking to the family. And that was the main one that stood out to me.
I agree with Heather. That's what I chose because I don't think that LPNs would be contacting the family, especially after surgery.
Yeah.
Mhm.
And that's correct because here's the thing. If that LPN, even if it's just a matter of them walking into the waiting room and saying, "Hey, your dad's out of surgery," that family is going to say, "How'd it go? Was everything okay? What happened?" They're going to ask a bunch of questions that the LPN will not be answering. That is on the RN. So it'd be different if they were just send him a text, "Patient's out of surgery," but that's not real life. That's not how it works. They're informing the family would open up a larger conversation that the LPN is not, that's not in her scope of practice, his or her scope of practice. Now, as far as reporting to the RN a change in vital signs, yeah, they're going to definitely do that. There will be LPNs working in PACU. PACU is usually a unique unit. It's kind of an open unit where you work as a team. And there will be LPNs, but if there's a change in vital signs, they're going to report it to the RN. Providing the client with ice chips, yes, that is in their scope of practice. In PACU, once that patient wakes up, that's one of the first things we want to do. We want to give them an ice chip, make sure they can swallow, and make sure they can pee. So that one is appropriate. Providing the client with a pillow to place over the abdomen, absolutely, I can do that. That makes sense?
Because
Everybody?
ice chips can be kind of confusing too, because if you provide them, like you said, see if they can swallow. Is that not like assessing their swallow? Am I saying that right? Am I going crazy?
Yes.
Yeah, you are.
Gag reflex.
Is not appropriate to delegate to the
And
LPN.
they're returning.
Is that one of those things though, where all it says is it's providing? It doesn't say that they're assessing. It doesn't say, all it says is they're giving them a cup of ice. As
Yeah.
far as complex goes.
And that's going to be standard in your PACUs, as we can provide them an ice chip. It's not like we're giving them a glass of water to swallow. Providing them one ice chip post anesthesia to moisten their mouth. I mean, that is definitely that's kind of an expected protocol within their scope of practice. What, Dr. Craven, do you have anything more to add to that as far as to clarify that?
No, I would just say make sure again that we're not reading into it, just clearly reading what that question is asking. That is all.
Okay, so is everybody okay? We've kind of concluded going over our test. Everybody feels like if you had that test again, you could make 100?
Yeah.
Only one of you? Come on, interact with me.
Yeah.
Okay. All right. Okay. Well, what we're going to do, real quick, this is only going to be about 5 minutes. Okay. We're going to have one more question. You're going to have a 5-minute breakout group to go discuss this question. Dr. Craven, this is slide 25.
Okay. Tell them hold tight. I'm going to make those breakout rooms real quick. Okay. You should be able to join your breakout room again.
And let's put slide 25 on the PowerPoint. Okay, so there's your question. Go to your group and come back with your answer, and we're going to talk about it.
I don't see the join breakout room. My only option is to just flat out leave this one.
Hold on.
We're working on it.
I don't see any.
We're working on it.
Oh. There we go.
All right.
Are you swapping rooms now?
So with this question, go to your breakout room and you're going to answer this question as a group and come back and answer it for me.
And it's asking you to join a room.
So we're different groups. Okay.
Yeah.
Phew.
I feel like somebody with a catheter is the least stable of the other ones.
It's the most invasive thing that's happened as well.
What do you think, Brian?
Well, I think, okay, so A, they're about to be discharged. B, I mean, stable bodies and fluids. We already went over the broken leg pain thing. That's obviously not a consideration.
Yeah.
So yeah, probably.
I don't know. I wonder if pain would be a priority over checking a catheter on somebody 2 days post-op.
We're good.
Somebody is breaking into Bane's house. Bane, get back on camera so we can make sure you're okay.
Yeah.
So I would think that would be more dangerous than I mean, just because the leg's hurting, I mean, it ain't gonna kill him.
That's kind of expected, I guess, right?
Yeah. What do y'all think? I think maybe a B.
I guess B because
That's
it's
what
a
I
kid.
was
They're
thinking
getting
too.
killed.
Was B.
Yeah.
Just because it's an 8-year-old and they might not verbalize that they're in
So
any.
since you're on here, Miss Wilson, can you agree with that on us? No comment. Oh well. Yeah, I think that's what it is, seriously, because it overflow them really quick with an 8-year-old. And the 15-year-old can suck it up for a minute with the pain.
Yeah. I don't know. With the 8-month-old, I mean, they're babies. Yes, he's going home. I don't know, maybe we'll make sure he's ready to go home. I don't know.
So with it saying he's discharged, then obviously like he's stable, because they're not going to discharge somebody who's not stable. So that was the only thing that maybe was like with me, you know, learning
That
with these
too.
questions, a lot that I've learned looking at stable and unstable were a lot of my issue previously. So what were you about to say, Lisa?
I was thinking when I first looked at it, I mean, discharge definitely, you know, popped out at me.
Yeah.